My name's Megan, and I have rheumatoid arthritis. I grew up in a town outside of San Diego, and I was a very active child. I currently work for a university where I manage a program advising students on external scholarships and fellowships. I had sort of early symptoms that were very unspecific, but it wasn't until I was in graduate school I became very, very ill with joint pain, but also fever and a rash. No one could quite figure out what was going on. When I was at my sickest, my wrists were so painful that it became very difficult to write either by hand or on a computer. It also made it hard just to think and to be creative and innovative. Trying several medications and not seeing any reduction in symptoms from them was very disappointing to me. Going from being someone who danced, who did yoga, to suddenly being someone who found it painful even just to get out of bed in the morning was devastating for me. I felt like I had to put most of my plans for the future on hold. Suddenly my body, which had always been reliable, was unreliable. I didn't know how I might feel from day to day. I first heard about Kineret from my rheumatologist based on my specific symptoms. She thought that Kineret might be a really good option for me. She explained to me that it was only available as a daily injection. At this point, it's just part of my routine. It's not really something I think that much about. My doctor provided me some information about the sort of usual response time for the Kineret, that for some people it starts working pretty quickly, and for other people it takes a little bit longer. We also discussed injection site reactions and that those are common for people when they're first starting Kineret. Those resolved within the first 4 to 6 weeks that I was taking the Kineret. I needed to make a commitment to really trying it out for an extended period of time to see if there would be any benefit for me. I was trying not to have high expectations in case the Kineret didn't work, but also really hoping that it might. I've had a reduction in the symptoms of swelling and pain and stiffness in my joints, but that's my experience, and not everyone may have that kind of effect from the Kineret. I've been able to return to a regular yoga practice. I returned to dance. I feel like I'm maybe not exactly the same as I was before I was diagnosed with rheumatoid arthritis, but I've been able to strengthen and use my body in ways that I didn't think I could. With RA, it requires a certain perseverance to work with your doctor and determine which medication is going to be the right one for you, and to also commit to seeing the medication through for whatever period of time it is that it really becomes effective. When you are able to bring all of the things that you've planned for, that you've worked for, back, or reopen paths that you thought were closed to you, it just fills you with an extraordinary sense of gratitude, of appreciation. I don't take my body for granted anymore and the things that it can do, because I know what it's like to not be able to do those things. I still have days where I'm more tired, or my wrists will have a little twinge here and there, but it's nothing like it was before.
Indications. Kineret Anakinra is a prescription medicine called an interleukin-1 receptor antagonist IL-1RA. Used to RA. Reduce the signs and symptoms and slow the damage of moderate to severe active rheumatoid arthritis RA in people aged 18 years and older when one or more other drugs for RA have not worked. NOMID. Treat people with a form of cryopyrin-associated periodic syndromes CAPS, called neonatal onset multisystem inflammatory disease, NOMID. DIRA. Treat people with deficiency of interleukin-1 receptor antagonist, DIRA. Kineret is not for children with juvenile rheumatoid arthritis. Important safety information. Do not take Kineret if you are allergic to proteins made from bacteria called E. coli. Ask your healthcare provider if you are not sure. Anakinra or any of the ingredients in Kineret. See the end of the patient leaflet for a complete list of ingredients in Kineret. Before starting Kineret, tell your healthcare provider if you have an infection, a history of infections that keep coming back, or other problems that can increase your risk of infections. Are scheduled to receive any vaccines. People using Kineret should not receive live vaccines. Have kidney problems. Are pregnant or plan to become pregnant. It is not known if Kineret will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Kineret passes into your breast milk. You and your healthcare provider should decide if you will use Kineret or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Kineret and other medicines may affect each other and cause serious side effects. Kineret may cause serious side effects, including serious infections. Kineret may lower your ability to fight infections. Call your healthcare provider right away if you get an infection, have any sign of an infection including a fever or chills, or have any open sores on your body. Due to the risk of infection, you should not receive live vaccines while you use Kineret. Serious allergic reactions. Stop using Kineret. Call your healthcare provider and get emergency help right away if you have any of these symptoms of a serious allergic reaction: swelling of your face, lips, mouth, or tongue, trouble breathing, wheezing, severe itching, skin rash, redness, or swelling outside of the injection site area, dizziness or fainting, fast heartbeat or pounding in your chest, tachycardia or sweating. People with DIRA may have an increased risk of allergic reactions, especially in the first several weeks. Decreased ability of your body to fight infections. Immunosuppression. It is not known if treatment with medicines that cause immunosuppression, like Kineret, affect your risk of getting cancer. Amyloidosis. Kineret may cause a buildup of abnormal proteins called amyloids around the injection site, a hard lump under the skin. Avoid using the same site to inject Kineret by rotating to alternating areas of the body. Your doctor may monitor you for amyloidosis. Low white blood cell count, neutropenia. Kineret may cause you to have a lower number of certain white blood cells, neutrophils. Neutrophils are important in fighting infections. Your doctor should do blood tests to check your white blood cell level before starting and during the first year of treatment with Kineret. The most common side effects of Kineret include injection site skin reactions. The symptoms of injection site skin reactions may include redness, swelling, bruising, itching, and stinging. RA gets worse with treatment if you already have RA. Headache, nausea and vomiting, diarrhea, joint pain, fever, feeling like you have the flu, sore throat or runny nose, sinus infection, pain in your stomach area. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of Kineret. For more information, ask your healthcare provider or pharmacist. You can also see the full prescribing information for Kineret, including patient information and instructions for use at https://www.kineretrx.com/pdf/full-prescribing-information-english.pdf. To report suspected side effects, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088.